I'm Charlotte Heaps. I'm a consultant liaison psychiatrist working in Warwick. And my special interests are functional neurological disorders and supporting autistic people in the General Hospital. I'm also a training programme director for less than full-time, flexible and accessible training for the West Midlands, which I think is a pretty unique role. And I'm now medical lead for liaison across Coventry and Warwickshire. I've had just over 9 years as a one long career break, totally out of psychiatry, and that was just after I gained my CCT. And during that period, I did no work whatsoever in terms of anything to keep up with CPD. I was totally out of work for a very long chunk of time. Maybe if I tell you a little bit from the start as to what happened. My training was all fairly straightforward, really. I was an academic trainee in Leeds, pretty straight path to getting my CCT. I had my first child towards the end of my training, came back part-time without any issues, and then had my second just as I was CCTing, and moved regions then down to the West Midlands to be closer to my husband's family. And thought, I'll just have a little bit longer than a year off since I can. I'm hoping to have a third child and don't want to go back to work pregnant or immediately going off again. So I'll just leave it a little bit, meaning 18 months instead of a year. And then I ended up getting pregnant with twins, they're now 10. And they I guess turned our life upside down, really, having 4 very young children at home. One of my twins has cerebral palsy, and that meant that I had up to 5 appointments with different professionals every week from her being a baby. Both my twins are now diagnosed autistic, and my eldest child, at the time the twins were born, wasn't coping in school, needed to be home educated. So the demands on me as a parent were unbelievable, really, compared to most families. It put a lot of strain on our relationship. I couldn't drink a cup of tea for about 3 years. It was totally overwhelming, really. And work was the last thing from my mind. I just sort of accepted that work was impossible right now. There was no way I could consider returning, even reading a CPD article. It was just another world altogether from where I was at that time. And that's how it was for quite a long time, really. It was only really, when the twins were probably 4, when I first started thinking, I'm kind of missing it. I really wish I could go back, but it's probably too late now. I've missed the boat. I've been out too long. There's no way I can go back after all this time. I guess the first thing I did was sort of fix myself and took up some hobbies and fixed my marriage, and ended up going to a conference. The college... The usual college annual conference was in Birmingham that year, which wasn't too far from me. So I thought I'll just go and see what it's like. I had a few old friends from Leeds that were going. Thought I'd just catch up with some old colleagues and see how it felt to be back in that environment. And actually, it was such a positive experience for me. I realised that I'd remembered more than I thought I had, and I was still really, really interested in all this stuff. I was really, really enjoying being back in an academic and intellectual environment again. Having normal conversations with adults, and met a few of the seniors in the college who were really, really encouraging and enthusiastic about me going back to work, and started to help me see perhaps it was possible to do that. Twins had only just started in reception, and perhaps it was a little bit early, really, to think about doing it, but in a rush of enthusiasm after the conference, I got my GMC licence back, and I have to say that was probably the easiest bit of the whole thing. People really worry about GMC licences, that getting a GMC back's not realistic once you've been on a break, but it was very easy. I had to pay some money to their offices in Manchester and get my photo taken, and that was it. I was back on the register, which I was quite shocked about, but here we go. So I waited a bit longer, really, worried about contacting anyone. I suppose my self-esteem was very low and was worried that no one would want someone that had been out of work so long. And I didn't have any contacts where I was because all my contacts were in Leeds. But after a long chunk of deliberating, I eventually plucked up the courage to contact my local trust, CWPT, and met up with the medical director there, and also attended a recruitment day, and just randomly did a mock interview out of the blue and thought that wasn't actually too bad. I could maybe do that again. And the meeting the medical director was a massive turning point. He was so welcoming and enthusiastic, and said, "Why don't you come and be a staff grade with me for a while? I could offer you the amount of mentoring that you need. You can build up your autonomy at a rate that you're comfortable with." And I was quite shocked, actually, that anyone would offer me a job at this point. So I was anticipating I'd be years being, sort of maybe 6 months or so of being unpaid as an attachee, and then years and years as a staff grade. And to be able to walk into a staff grade job was fantastic. So I suppose I was still wondering whether or not it was going to work with my family. And then, of course, COVID hit. And you may remember there was a big campaign to get doctors back into work that were out of work. And I fell into that group of people that could then sort of be encouraged to go back in with no college return fees, no GMC fees for a year. And I really felt a moral obligation to help out at that point. If you remember the level of hysteria at the beginning of COVID, and the doctor that was currently doing the job on with the early intervention team was a GP trainee who could actually go back and help out on a COVID ward. So I felt taking the post was sort of really important for me to do my bit in the effort at the time. So within a week of the first lockdown, I was employed and back at work, and it suddenly happened very quickly. I felt like a massive imposter for the first 6 months at least. People would say Dr. Heaps, and I would look round and think, where's my husband? It just seemed ridiculous that people were asking me for advice. But Dr. Onion was fantastic, my mentor, in giving me the right amount of support to build up my autonomy at the rate that I felt comfortable with. I had my patient slots, much longer slots than you would normally get, and gaps between them, so I had time to read around, and I actually felt reading around, it worked so much better for me than trying to relearn everything in advance of going back clinically. It just felt much easier. And what I was surprised about was actually all of my non-clinical skills were there. They'd not really gone at all. Dealing with uncertainty and complexity, dealing with difficult relatives, dealing with all kinds of complex team situations, and management plans that have to break away from any kind of protocols. All of that stuff was fairly straightforward. The stuff that I didn't remember was all the facts and figures. But of course, with current technology, BNF is on an app on your phone. The NICE guidelines are there at the click of a button. Everything's in the Maudsley guidance. All those facts are actually fairly accessible, aren't they? And it's the non-clinical skills that were the stuff that I really needed to retain, and those were the ones that I did retain, so it was much easier than anticipated. I was encouraged to have a very early 360 appraisal from the team, which was a really good move because that gave me some confidence that none of them saw me as a new returner. They were surprised when I said that I was. And that really boosted my confidence. The other thing that massively helped at that stage was that I was given a flexible working agreement where I could finish at 3 o'clock on 2 of the days of the week, so that I could then go and manage to do the school run, which without that I still wouldn't be back at work, given all the additional needs of my children. After school care is just inappropriate for them to have. So the combination of all of those factors made a massive difference in me successfully returning. I would say one of the trickiest bits was getting my Section 12 approval back. That required me to have completed my 50 hours of CPD to get my CPD signed off, which I did in 3 months. So I really raced through getting as much CPD done as possible. I kept in contact with some colleagues from Leeds, and we'd done quite a lot of informal case discussions together, and they were able to sign it as a reference after keeping up sort of connections and cases with them. So I was able to get my Section 12 back, but I'd say that was the hardest standard and the hardest hoop to jump through out of the challenges that came. And then after being only a month or 2 back in the staff grade job, my dream consultant job was advertised. And I was gutted because I just thought this is far too soon to be able to go for a consultant job. I'd only just started back as a staff grade. This was on my sort of 5 to 10 year plan, not my few months plan. But it was in liaison. It was 10 minutes from home. It could be done part-time. And And the medical director was saying, please, we'll try and hold the job for you for a little while. We'll put the interviews out as late as we possibly can. You'll be offered a mentor. You can carry on with the part-time and the flexible hours that you're doing now. And I suppose I was really shocked that other people would have believed in me to the point that they'd be keen for me to get a consultant job as quickly as I was. But that's what happened. And I worked for the interview, and was appointed to start that September, 6 months after I first went back to work. So that was back in the end of 2020. I've now been a consultant 4 years. Again, the things that make the consultant job workable was the fact that it was flexible, it was part-time, there was fantastic mentoring, and really to notice the two people that were the best mentors for me were both male and they were both full-time. So it doesn't have to be other women that are doing this support, although of course it's great when we do. The other thing that I really noticed is after the decade of austerity cuts in the NHS, so many of my colleagues are burnt out and fed up compared to when I left. That's the reality for many people in the NHS at the moment. But I didn't feel like that because I'd sort of missed that whole decade. And I've been able to come in after a long break feeling really enthused and energised, and made quite a lot of changes and developments in my team, which have been really positive to do that, actually. And I think people have liked the sense that I've come in and not being quite so burnt out and run down by the NHS as many people currently are. So just after a year in as a consultant, my senior colleague then left. Meaning that I was then the most senior consultant in the team, and soon after that became medical lead and TPD. So it's absolutely possible, despite a very long break, not only to return but also to really rise up the ladder, I suppose, in terms of getting those more senior management roles. And all of those that I've done so far have very much been doable part-time and flexibly. So it's not. Please don't rule out the possibility of senior leadership roles if you're only able to work part-time around a family. That's probably the gist of my experience, really. But it's been a really positive experience to return. I feel like I've got my identity back as a doctor, which was a massive thing that was missing for me. I would say take the break, forget about work. If you've got life commitments that need you, if you've got, caring responsibilities, or other stuff going on in your life where you just need to focus on that full time, you only live once, and if that's where you need to be in that point of your life, that's where you need to be. I've absolutely no regrets whatsoever about taking a break. And the return was far easier than I anticipated it to be. There were plenty of people that were really supportive, and here I am a few years later thriving in it, and there's no reason why you wouldn't be able to do the same. Yeah, no, I think I've said quite a lot about that. I really enjoy my role as a consultant. Like I said, I feel like I've got my identity back, using my brain again, and thinking about something other than the children is fantastic. So yes, I'll go to work for a break, which is great. One last thought is just really never apologise for your break. I think people often go off on breaks and they're worried that they're going to look bad for it. I would say just don't apologise, just own it. I've learned so much in terms of conflict resolution, prioritising many conflicting demands, organisation, negotiation, all those skills for me anyway, from sort of high needs parenting are so translatable into work. The empathy I now have for people that are in very complex family situations and carers themselves that come in as patients, is far, far higher than it ever was. And those skills shouldn't be underestimated.